Hi, very good evening. So I've asked you one question about the metals which are used in their purest form in dentistry. So, as you rightly said, gold and titanium. If you look into gold, it's not the indirect restorations we're talking about. In case of direct restorations, direct filling gold, we almost use 99.99% pure. In fact, gold and titanium are the only metals which are used in their purest form in dentistry, right? So, very good evening, all of you. Let me know whether it is streaming fine or not. Also, let me know if my voice is audible, or else I'll try raising the level. Okay. Hi, Supratim, Rakshita, Jenia, Himanshi, Akila, Pranav, Rohit, Ramya, Pooja. Hi, very good evening. So, all fine? Okay, perfect. So today we'll have a discussion from dental materials. So I have framed few questions in the form of who am I format. So we had this format previously also. I'm sure it's going to be interesting and equally challenging. So I'll do one thing. I'll try to post the question in the comment section. Also, I'll try to read out the question for your convenience. So try answering as fast as you can, right? I'm sure it's going to be interesting. So we have set of 10 questions in who am I format, right? Okay, you have headphones. Yeah, that's even more better. Hi, Ankur. Hi, Ria. Very good evening. Okay, we'll have our first question. So the first question is of a material to absorb elastic energy and to deform plastically before fracturing. Who am I? So you can see the question in the comment section. The question is, I am the ability of a material to absorb elastic energy and to deform plastically before fracturing. Who am I? So which of the words would fit into this particular description? Form of a definition, but based on the description given, which word do you think fits into this particular description? In fact, we have covered the same in our e-classes under the title stress strain graph. So this particular entity is the area which is covered under stress strain graph. So I'll repeat the question. I am the ability of a material to absorb elastic energy and to deform plastically before fracturing. Who am I? So Ramya says modulus of elasticity. Nahida says toughness. Divya says resiliency. So we have different terms. Pranav says modulus of elasticity. So I think majority of you are going with some. Ankur says hardness. Devangna says elastic modulus. Okay, I'll leave this question unanswered. I'll get back to the answers at the end of this session, right? Is it fine? I want you to think in the meantime. So the first one, I am the ability of a material to absorb elastic energy and to deform plastically before fracturing. Who am I? So we'll move on to the next question. Don't worry, I'll give you all the answers by the end of the session, right? Okay, second one, I'm the resistance of a material to plastic deformation. who am I? We're talking about resistance of a material to plastic deformation. Who am I? In fact, we've done a video on this specific topic in our e-classes DM section as well. So we're talking about resistance of a material to plastic deformation. See, creep is something where there is time-dependent deformation, isn't it? But here in this particular question, we're talking about resistance of a material to plastic deformation. So which property would fit into this particular description? Hardness, creep, elastic limit, stress. Okay, we're getting mixed answers. I'll leave this question unanswered. I'll give you straightforward answer only when I get a unanimous answer. Okay, that's the deal. Okay, Young's modulus, stiffness, elastic limit. Okay, we'll see. Let's hope for at least for the next questions we'll be getting a single straight answer, right? I'll let you know the answer at the end of the session. Third one, it's going to be interesting again, and I'm sure it's going to confuse you because the first two questions are more or less like resistance to elastic deformation and all. So the third question is, I'm the relative inability of a material to deform plastically before it fractures. Who am I? Third one, you can see in the comment section now. I'm the relative inability of a material to deform plastically before it fractures. Inability of a material to deform plastically. So who am I? Ramya says toughness. Abhishek says toughness. Genius says brittleness. See, the question says relative inability of a material. So there is no unanimous answer again, so there is a mixed response, toughness versus brittleness. But I see Madhav says resiliency, Arpan says toughness, Vaishnath says modulus of elasticity or stiffness. So again, no unanimous answer, but anyways, we'll leave this question unanswered. Okay, so we still have 7 more questions in this particular format, which are of different categories. So before going into them, let me give out the answers for these first 3 questions. Elastic energy and to deform plastically before fracturing. It's nothing but toughness, as few of you rightly said. Toughness, ability to absorb elastic energy and to deform plastically before fracturing. So that's nothing but toughness. The second one, I'm the resistance of a material to plastic deformation. See, we discussed about material and the indentation load and then trying to analyze the hardness of that particular material. So hardness is nothing but the resistance of a material to plastic deformation. So we have different kinds of hardness, micro and macro, which we discussed in detail in our e-classes, right? So plastically, before it fractures. It's nothing but, we're talking about brittle materials, brittleness. Take for example amalgam or a ceramic. They do not have that ability to endure forces or to absorb the inability of a material to deform plastically, which is nothing but brittleness. So try to compare these properties with the materials which you are familiar with. It will be easy for you to understand and grasp the concept, right? You need not by heart all these definitions. It's only for sake of your understanding. Understanding the definition is very important. It doesn't matter whether you by heart it or not, right? So the first 3 questions, I hope it's clear. So shall we proceed from the 4th one? Because from 4th onwards we have like different categories altogether. So to end your confusion and to give you more clarity, I've given you the key for the first 3 questions. So shall we proceed? Okay, perfect. So what about the first three questions? Could you follow the answers and all, or do you want me to repeat the first three questions as well? Okay, sure, I'll definitely repeat. So the first one, we're talking about the ability of a material to absorb elastic energy and to deform plastically before fracturing. It's nothing but toughness, as most of you rightly said. So it's the ability to absorb elastic energy and to deform plastically before getting fractured, right? So that's toughness. And the second one, resistance of a material to plastic deformation. We have discussed this in detail in our e-classes. You take a given surface and try to analyze its hardness by using some indentation force, by checking the resistance of that particular material to plastic deformation, which is nothing but hardness. So we have different kinds of hardness like micro and macro hardness, which we discussed in detail in our e-classes. You can refer that for more information. So the resistance of a material to plastic deformation is nothing but hardness. And now coming to the third one, relative inability of a material to deform plastically before it fractures, which means brittleness, isn't it? Take for example amalgam, take for example ceramics. See, they do not have this ability to absorb forces and to deform plastically. The moment there is some threshold force acting on them, there will be fracture, or we say they are brittle, just like your glass, ceramic, or amalgam restorations. So this is nothing but inability of those materials to deform plastically before they fracture. It's nothing but brittleness, as few of you rightly mentioned, right? So these are the answers to the first three questions: toughness, hardness, and brittleness respectively. So try to compare these properties, or for that matter any dental material related properties, with that of materials which you are familiar with. So once you start comparing these properties with the materials which you are familiar with, it will be easy for you to understand and grasp the concept, and also you will easily remember it, at least till the date of exam, or if not, till your entire professional career. So try to correlate these properties or the meanings rather than merely by hearting the definitions. You need not by heart these definitions, not at all required or necessary. Just try to get the concept right and try to apply them with the materials which you are familiar with. It will be much more fun learning all these things, right? Okay, perfect. So since everything is going on fine, I think we can proceed with an improved pace now. Now, moving on to the fourth one. I'm sure you're going to answer this, but let's see how it goes. Fourth question. I am a time dependent deformation produced by stress. I am responsible for marginal breakdown in amalgam. Who am I? So, just like a student who is subjected to stress during preparation, I am a time dependent deformation produced by stress. I am responsible for marginal breakdown in amalgam. Who am I? I'm sure you might have been bombarded with this particular term right from your second year undergraduation, so I'm sure you'll do good in questions which are especially from these subjects, right? Exactly, creep. Creep is nothing but time dependent plastic deformation which is produced by stress, and it's responsible for marginal breakdown because of a popping out of amalgam from the KO surface margins, leading to marginal breakdown, and you know what happens, unwanted sequelae, micro leakage, staining, discoloration, sensitivity, etc., right? Hi Lakshmi, a very good evening. So creep is right answer. Now moving on to the fifth one. You might have come across this particular term in metallurgy. So I've given you a hint. I am applied to metal surface so that I dissolve oxides or prevent their formation. Who am I? The fifth one, I am applied to a metal surface so that I dissolve oxides or prevent their formation. In other words, we're talking about a reducing agent. So who am I? It's good to see a unanimous answer. Flux. Wonderful. So flux is nothing but a cleaning agent or cleansing agent, which is a reducing agent which prevents formation of oxide layer on a given metal surface, thereby promoting soldering, brazing or welding kind of techniques. So that's nothing but your flux. And a material which is used to control the flow of flux is nothing but anti-flux, Lakshman Rekha, something like that. So various examples of flux, as you know, include borax, graphite. We have n number of materials which can be used as flux. So basically flux is a kind of reducing agent, a cleansing agent which prevents the formation of oxide layers, and some fluxes also help in removing impurities from a given surface, thereby facilitating welding, soldering or brazing procedures. Right? Very simple, and I'm glad that you all have given a single, straight and right answer. Now let's move on to next one, sixth question. Sixth one, I'm a polymeric material and I'm used to replace intaglio surface of an existing denture. Who am I? I'll repeat, I'm a polymeric material and I'm used to replace intaglio surface of an existing denture. Who am I? So we have a specific term for this, polymeric material. Tissue conditioners are different, Ramya. They even have a topic called rebasing and relining. So you might have come across this term there. So it's a polymeric material which is used for replacing the intaglio or nothing but tissue surface of your denture. Who am I? I've given you a hint. I've given you the name of the topic, but not the term we're talking about. It's a liner, a lining material, liner, exactly. So liner. So this particular explanation fits to the term liner. So it's a polymeric material which is used for replacing the tissue surface or intaglio surface of a denture. We have a polished surface and intaglio surface, right? So this particular material replaces the intaglio surface of a complete denture. It is nothing but a liner. You might have come across this in relining and rebasing, isn't it? Exactly. Yeah, denture lining. Okay, seventh one, a very interesting one. Let's see how it goes. I am the process by which living bony tissues form to within 100 angstroms of implant surface without any intervening fibrous connective tissue. Who am I? I'll repeat. I am the process by which living bony tissues form within 100 angstroms of implant surface without any intervening fibrous connective tissue. Who am I? We're talking about a process of bone formation within the proximity of the implant material without any intervening fibrous connective tissue, thereby achieving a durable bond. So what do you call this process? Wow, wonderful. So it is osseointegration. So the description aptly fits to the term osseointegration. And who has given this concept of osseointegration? Yes, it is osseointegration, and this concept was put forth by brain mark, as Divya Ankur Lakshmi rightly said. And who has coined this term osseointegration? Yes, Vaishnath. So who has coined this term osseointegration? Exactly. It's again Brenmark. So Brenmark has put forth this concept and has coined the term osseointegration, and this is very, very important, especially the criteria. It's a process by which living bony tissue forms to within 100 angstroms of implant surface without any intervening connective tissue, fibrous connective tissue. If at all there is any fibrous connective tissue, it acts as an impediment to the true union or the osseointegration process as such, right? Yeah, it's the same, a brain mark. Okay, so brain mark has put forth this concept and has coined the term osseointegration. Now, eighth question. On the process of reinsertion of a tooth back into its jaw socket soon after intentional extraction or accidental removal. Who am I? I'll repeat. And the process of reinsertion of a tooth back into its jaw socket soon after intentional extraction or accidental removal. Who am I? Reimplantation, replantation, okay, replantation. So this description aptly fits to the term replantation, right? So replantation is nothing but reinsertion of a tooth back into its jaw socket, which has been extracted either intentionally or by accident. Replantation. Simple comparatively, I do understand. Okay, let's see how many of you are going to answer this right. Penultimate question. And the ability of a material to form new bone. Who am I? A single phrase, a simple phrase. Ninth one. I am the ability of a material to form new bone. Who am I? Yeah, bone grafting, many materials can be used, either natural or artificial. Yes, osteoinductive or osteoinduction. Its ability to form new bone material, whereas osteoconductive is acting as a matrix and providing an environment which is conducive for bone growth. That's osteoconductive. But osteoinductive is the ability to form new bone material. Wonderful. Osteoinduction or osteoinductive? Okay, final question, 10th one. I'm the mold channel, mold, MOLD. I'm the mold channel through which molten metal or ceramic flows into mold cavity. Who am I? So the final one. I am the mold channel through which molten metal or ceramic flows into mold cavity. Who am I? So we discussed about its specifications, the length, the angulation, the positioning of this particular entity, and also we have an important parameter called reservoir. Exactly. Sprue. The sprue is an entity through which molten metal enters into the mold space, thereby enabling us to cast a given wax pattern, isn't it? It's very, very important. Good. Okay, so these are some of the questions which I wanted to share in a different format possible so that it would be interesting comparatively. So I'll just summarize all the questions once again before we conclude the session, right? Yes, Sprue is the right answer. So we'll just have a brief summary. So the first one, so those who missed the first few minutes or since there was some issue with the live, so I'll just try to go through all the questions once and for all. The first question, and the ability of a material to absorb elastic energy and to deform plastically before fracturing. It's nothing but toughness, right? Ability to absorb elastic energy and to deform plastically. Whereas resistance to plastic deformation is nothing but hardness. So hardness is a property where there is resistance to plastic deformation. Whereas inability to deform plastically before fracturing. So this inability to deform plastically is nothing but brittleness, right? So just consider some examples which you are familiar with. It will be easy for you to understand and remember. Also refer stress strain graph video in our e-classes DM section. We have discussed lot many points in that particular video along with hardness video, right? Now the fourth one, I'm a time dependent deformation produced by stress. I'm responsible for marginal breakdown in amalgam, which is nothing but creep, time dependent plastic deformation. Fifth, I'm applied to metal surfaces so that I dissolve oxides or prevent the formation. So we're talking about fluxes. So these are cleansing agents, right? These are reducing agents which prevent oxide layer formation, thereby facilitating welding, brazing, or soldering procedures, right? Sixth, I'm a polymeric material and I'm used to replace intaglio surface of an existing denture. We're talking about relining, we're talking about liners, polymeric materials. Seventh, I'm the process by which living bony tissues forms within 100 angstroms of implant surface without any intervening fibrous connective tissue, which is nothing but osseointegration, concept put forth by Brenmark, and also the term osseointegration was coined by Brenmark. Eighth, and the process of a reinsertion of a tooth back into its jaw socket after intentional extraction or accidental removal. It's nothing but replantation. Ninth, the ability of a material to form new bone, it is osteoinduction. Osteoconduction is different again, right? And final, I'm the mold channel through which molten metal or ceramic flows into mold cavity. We're talking about sprue, right? So the sprue angulation, dimensions, and positioning are very important, especially when you're casting a wax pattern, right? So these are some of the topics which I wanted to highlight in this specific video. I hope it's clear, and you have any further queries anytime, you can always get back through mail at proudtobedentist@gmail.com, right? Okay guys, so you're most welcome, and we'll see you again in another live session. I'm trying to incorporate more live sessions in these 10-15 days. Let's see if it happens. So we'll have all our sessions as per the schedule. We have a general session this Sunday. Coming up, we'll discuss another interesting, important, and general topic which will be relevant to your preparation as well. Right, so wish you all the best. And before I conclude, just keep this in mind, it's almost halfway down the lane. We have been traveling with our academy for the past 4 or 5 months. So we still have another 6 to 7 months of time. So whenever we start something new, we all start with some sort of excitement. And it's natural that with time the excitement dies down. But time and again, it's our duty to remind ourselves the fact that we are doing something which is for our own benefit. You are preparing for your own benefit, not for sake of others, isn't it? So time and again you need to remind yourself of the fact that why you have been preparing and what's your driving force. We all start with a lot of enthusiasm and excitement, but as time goes on, it dies down. And it's quite normal during student phase. I do completely understand it. But do not consider that as a negative side, rather, consider that normal. But see to that you constantly motivate yourself. And I have explained you, given you numerous ways through which you can do that. Keep in touch and very simply ask yourself these questions like why you have been preparing, what's your driving force, and how would you like to see yourself in the next 1, 5 years, 10 years, or 15 years. Think long term but act short term. That's very, very important, isn't it? So it's all about giving your best each and every moment. You have plenty of time. All you need to do is just focus on the present moment. Focus on giving your best in the available time possible. Even if it is for 1 hour, 3 hours, or 5 hours, see to that you are satisfied in your preparation. If you're not satisfied, then see to that how you can satisfy yourself in the process of your preparation. Because no matter how much you study, if you stay dissatisfied, that's going to hamper your preparation. That's going to act as a demotivation. So no matter how much time you allot, you try to stay motivated, and that's very, very important, right? So once again, wish you all the best, and for any further queries you can always contact me through mail. So keep working. It's all about working hard, working consistently, and most importantly, believe in yourself. And just focus on what you have to do now. Forget about your past experiences or past memories. Do not have high expectations or low expectations. It's better not to have any expectations at all. Do not speculate, because once you start having expectations, we start speculating. Like what happens if we don't achieve that? What happens if we don't crack entrance? So all this is unnecessary, unwanted at this particular juncture. All that you have right now is the time, which is ample enough for you to crack your entrance. So make sure that you utilize your time wisely and see to that you give your best each and every moment. When I say it, I mean it. You're attending this live session, just pay complete focus, make notes of important points, and then try to revise. If you're preparing, practicing multiple choice questions, do that in a right manner possible, which we discussed previously. If you're watching videos, try to make notes accordingly. And it's also equally important that you take periodic breaks. And we'll definitely have more videos coming up pertaining to these issues, and just give your best. That's the only thing you need to keep in mind. And as I said, we start with enthusiasm and it dies down. Consider that absolutely normal. Do not worry about it at all. Right? So, see you again this Sunday in our next general live session. And if at all we're planning any live sessions in the meantime, I'll definitely let you know. Just keep a tab on Google and WhatsApp updates group. Love you all.